Hello and welcome to the Food for Health Summit hosted by Access Community Health Network. I'm Dani Lazar, the Executive Director of Research, Evaluation, and Innovation here at Access. And today I'm with Jess Lynch, who is a Program Director with Alliance for Health Equity, and Angela Odoms-Young, who is Professor at University of Illinois, Chicago. Today's event has been really a meeting of the minds, and we are joined by our subject matter experts and lots of different organizations and health systems to talk about food insecurity and health and what are the things that are innovative in our neighborhoods, in our community, and what are the next steps. So Jess and Angela, just a couple of questions to start you off. What's the current state of play when it comes to food insecurity and health interventions across the Chicago area, and what have you been thinking about?
Well, I think on the heels of today's event, it was very exciting to see so many different folks from different sectors, different communities here in the room, and clearly there's a lot of existing partnership going on. I think people really recognize that food security is an issue that impacts communities all across, not just Chicago, but the suburbs as well. And so it was really interesting to look at some specific local areas where nearly 50% of people in the community are dealing with food insecurity, and even in some of the suburban communities as well. So really thinking about how to partner is exciting, and a lot of great ideas.
Mm-hmm. Angela, what were some of the main things that you started to hear from people as we were talking today?
I think the importance of really thinking about how we can work together, because when you look at something like the issue of food insecurity, that a household or people within a household would fear they're going to run out of food and not have money to buy more, or this idea that you don't have enough food to lead a healthy and active life. This is something that really is so closely linked to health. And most of the partners in this room, they've acknowledged that, they've been working on that, and then now we have to figure out how do we get together and think more about what are those policies that can help support that. So when we look at payment, or we think about measures, or we think about incorporating those processes, it's sort of the daily flow of the work that both healthcare providers and food providers do. It's really important, and I think a lot of people were sort of on the same page and thinking about that.
That's great. So what were some of the goals of today's summit? We had so many people from lots of different sectors and good work, but what were some of the goals that we were hoping to take away from today's summit?
So I think that there was really a great opportunity to actually share some findings from the work that you all have been doing at Access, and also the landscape of all of the different partnerships that already are going on in our area. And so I heard from participants both before and after the event that was really what drew folks here today and made this a different meeting than maybe one we would have had a year ago. So some of these efforts are far enough underway that we're really starting to learn from them, and everyone's really excited to share those learnings and speak not just across organizations but community members to really think about how do we learn from those initial findings and continue to scale and strengthen the partnerships.
Were there a couple of aha moments? They had a lot of people reporting out about these innovations they were doing, whether they were meal delivery pilots or different kinds of vegetable delivery programs or food insecurity screening programs. Were there any aha moments for you, Angela, as you were thinking about things during the day?
One of the aha moments that I had, and just really kudos to Access around presenting some very detailed results related to the pilot, the meal pilot, and other referral initiatives that you've been implementing. I think there's a few things that came out of that. One is, what are we measuring? And the other discussions, are we really understanding the mechanisms? And then what tools are we using? And I think the other thing that becomes really important that we need to continue to think about is that idea of not losing the participants or the community members' voice. Because some of the things that they felt were important, even in your report out. This idea that it could be an economic support. We may be looking at health outcomes, but part of that thinking about what are the benefits to a community, alleviating social isolation, all of those things we know will eventually contribute to better health if we look at the social determinants of health. So those social connections, we think food, and we're thinking about the dietary intake pathway, but actually there may be 20 pathways to link some of these programs to better health outcomes. And I think that's really the aha moment, learning what are those mechanisms behind this work.
Yeah, I think what I heard a lot was about relationships.
Yeah.
And that at core, some of this is not just about relationships between individuals, but also their relationship with their care coordinator, or in our case at Access with the meal delivery pilot, with the person who is actually delivering the meals, and that was a way to engage things. So really exciting work. So what are the next steps? We brought everybody together. What are the next steps? I'm looking at Jess as our leader from the Alliance for Health Equity. So what are you thinking about for next steps?
Well, I mean, I think we had, first of all, it was exciting that so many folks really stayed throughout the whole day. So we had really robust discussion at the end around 3 topics. So the evaluation of metrics, how do we continue to improve screening and referral for food security programs, and then what's the broader set of interventions that we need to be partnering on to really improve access to healthy food in communities. And so the next steps are to collate all this information and really build on the momentum that we have, and people who are volunteering as they walked out to join on those small groups. So we'll be moving that forward. And I think, as we were just chatting before, people are really eager to see this move into action, because we've been having these discussions, and I think everyone saw today, like, there's tangible results that we can build on, and how can we really not delay our move towards more of a collective action agenda and research agenda. So I feel really hopeful about that momentum, and I think we have enough here to be able to really come up with sort of a draft of a theory of change, and some steps that came out of the collective group in terms of initial next steps to bring back and really hone with the broader set of partners.
Definitely great.
Any thoughts on next step as a researcher?
Yeah, of course, researchers, they go directly to the data, but just to build on Jess's point, this idea of looking at the theory of change, because that becomes so important. If we can have tools like the 2-screener questions for food insecurity, but if we don't really have one of those constructs or mechanisms or pathway, it's very hard for us to understand shared success. So to think, the different people may be on different parts of that continuum, or they may end up measuring different aspects, but really having some, from a research standpoint, really understanding, what are we trying to accomplish and what does success and impact look like is key, because if not, we won't be able to sort of capture that and tell the story. And the key is to really tell the story to policymakers, to payers, to community, to patients, to other health systems. So can we tell that story? And we really need to know the ending, at least where we're going. So maybe not necessarily what's the result, but at least maybe not the ending, it's not but we have to know the theme, the plot of it, so we need the plot to kind of tell that in and for it to make sense. So having that shared collective thinking and model is key.
That's great. That's great. Well, thank you both. Thanks to Jess and Angela, Dr. Odoms-Young, for being with us here, and for hosting the summit with us. And thank you to all of the viewers for tuning in from the Center for Discovery and Learning and Access Community Health Network. Please don't forget to learn more about Access and the work we're doing in the community by going to www.achn.net. Thanks so much, and have a great day.